Greetings everyone. I am Ngabuto Nicholas Mabena. In this video we are discussing the Immigrant Health Access Fund. We are all aware of what is happening in South Africa from members of Operation Dudula, March to March, and the other community members. They are blocking access to health facilities to migrants. We understand where they are coming from. We do not support what they are doing, but we understand that when the economy is going down, the blame naturally goes to migrants. What we are doing is to come up with a solution. It might not really be a solution that will see all migrants not going to public facilities, but at least we want to bring a solution on the table. We understand the burden in public health facilities by migrants. One of the advantages that I have and my colleagues is that we do engage the political leadership in this country. They are telling us that when they do door-to-door campaign, they receive negative reports about migrants. They are saying their health facilities are overwhelmed because it is said that migrants want to access these public health facilities without paying a cent. The Zimbabwean government has already said that it will not pay any cent towards the health care of Zimbabweans that are in South Africa. We are talking about Zimbabweans that are working in South Africa, who for different reasons would want to access health facilities, but at this stage they are being denied. Because these are working Zimbabweans, they do afford not to pay what is required, but they do afford to make a contribution. For instance, someone sends a message to us, says that works as a domestic worker, had gone for an operation, he owes the hospital 40,000 rands, and that money must be paid. The question is, who is going to pay that money? This worker does not afford to pay the 40,000 rands. Another worker says that money is being deducted from their salaries towards a health fund or health insurance. But then when they go for treatment, they get blocked. We are ourselves, through this initiative, trying to ease this burden in public health institutions, because we know that this issue is going to gain center stage as political parties campaign for the local government elections. So we are saying to migrants who are working, because they are working, that there is nothing for free, right? We need to underline this. We are not setting up a free health fund. A worker is expected to make a small contribution to the fund. We are engaging the donor community to cover the rest. Let me put it this way so that people understand. A worker can afford to make a monthly contribution of say 180 or 200 rands a month, right? Monthly contributions of either between 180 rands to 220 rands. That is affordable. But when this worker needs hospitalization, they will not have the money. This is where the donor community, through this initiative that we're putting, come in. So we are saying, as migrant workers, we must show commitment that my wife is expecting, I am working, I need to make a small monthly contribution for my family, myself, my wife, and the kids. But when my wife goes to deliver, more money will be needed, which I might not afford, or we might not afford as a family. This is where the donor community comes in. So this initiative, which we are still, as I said over the weekend through my Facebook post, that we are resolving some legal issues because we wanted this fund to be registered, the government, in terms of the laws of South Africa. We need to approach government, make this proposal. We need to have a proper governance structure, meaning that we are setting up a proper management team that will do this work on full-time basis. We want to provide a professional service, a full-time work on full-time basis, a management team that will be working on this daily, overseen by a board of trustees of prominent individuals that are respected in society, who are busy engaging them. We do not want a fly-by-night thing. We want to have a proper management system overseen by the board of trustees, so that the joining fee that the migrant puts in, the migrant worker, the money that donors put in, every cent is accounted for, every cent does what is meant to do. So we will explain in the next videos on the services that this fund is going to cover. But we have noted, as we continue to have these meetings, we continue to deliberate, there are people on chronic illness. There are pregnant women. There are children who need immunization and other diseases which we need to cover. So we're engaging health practitioners who are going to be working with us. It's not that we are going to set up open up a big private clinic. No. We are working with partners for the safety of the migrants. Instead of the migrants going to Hillbrook Clinic, we will direct them where to go, those that are members. So as I said, as I move into conclusion, that there's going to be a joining fee, a membership card, and we are clear on who is to benefit and how they benefit. If you want to get more information as we continue to resolve these legal matters, please drop me a WhatsApp. We'll set up a group so that we explain to explain these things to you so that you understand what we are seeking to do. You have my number on your screen, 083 340 1000. Please like this video, subscribe to this YouTube channel. If you're on TikTok, please do follow us. Otherwise, goodbye.